Kenya's long wait for the COVID-19 vaccine finally ends in a matter of hours, with the arrival of the first batch expected at 11:23 p.m. We now actually have the exact time. Kenya plans to vaccinate 30% of 15.8 million of its total population, or 49 million, by the end of June 2023, a process straddling 3 government financial years. But in this first phase, the vaccine supply is limited and will target priority groups, with frontline health workers being first in line and individuals offering critical and essential services. We examine the last leg of preparations and who among the priority groups is eligible and who isn't. Dorcas Wangira reports.
Kenya will finally get its first consignment of vaccines from the COVAX facility after a wait that has been long and winding. Once the 1 million doses arrive, the government has put in place the National COVID-19 Vaccines Deployment and Vaccination Plan 2021, one that is elaborate to ensure that the distribution begins almost immediately after the vaccines are cleared. During Phase 1, the initial COVID-19 vaccine supply will be limited, targeting priority groups, frontline health workers, that is, all individuals involved in service delivery in all health facilities and at administrative levels, critical services, teaching and non-teaching staff in all educational institutions, uniformed forces, police, military, prisons officers, immigration officers, and instructors in religious institutions.
We risk losing more teachers, and the more reason why we are encouraging all of them to accept the vaccine so that we can reduce the mortality rate with respect to COVID-19 within the teaching service.
Early vaccination will focus on administration sites that can reach prioritized populations with as much throughput as possible. Level 4, 5 and 6 hospitals, estimated at 5% of the total facilities, approximately 284 government and 195 private health facilities. But who, even in this first phase, is eligible? Individuals will be eligible for vaccination if they present to an immunizing health facility within the selected sub-county where they have been registered for vaccination, or any other health facility where they present evidence of registration for vaccination, and must have not been vaccinated against COVID-19 before. They should have no fever, that is, temperature currently above or 38 degrees Celsius. Individuals who present with fever will be asked to return for vaccination once the fever has subsided. Professor Walter Jaokwa, Professor of Medical Microbiology and Tropical Medicine, who is also the Director of the Kenya AIDS Vaccine Initiative, KAVI, further explains.
But if you are a pregnant woman, you will not be given the vaccine. Why? It's just because we have not done studies on the vaccine in pregnant women. And 2, if you have a history of severe allergies. And so the problem is that we don't know whether the people who have severe allergies will also react severely to this vaccine. So for that reason, they are not being given.
Also, one must not have suffered a COVID infection within the last 6 months preceding the day they present for vaccination. One should not be pregnant or breastfeeding at the time of vaccination. However, a pregnancy test will not be required before vaccination. An eligible person must also provide verbal or written consent for them to be vaccinated.
If you are an asymptomatic person, you have no symptom, so you will get the vaccine. The thing is that you're not going to test people to see who is COVID negative or who is COVID positive before we decide who to give. So it will be given massively. Being
a novel vaccine with recommendations for an initial target population, Kenya will explore non-traditional vaccine delivery approaches to ensure maximum reach for especially the target populations. For example, the utilization of special clinics for vaccination of people with comorbidities. Kenya will use existing storage for the AstraZeneca vaccine in the main storage site in Kitengela and the 9 regional vaccine stores at 2 to 8 degrees Celsius. Negative storage temperature vaccines will only be considered during Phase 2 and Phase 3.
We have several types of vaccine carrier.
The government continued its capacity building for health workers, with health CECs undergoing training before the arrival of the vaccines and planned rollout.
We're working through the preparedness steps for them to receive and roll out the vaccination to the 47 countries as soon as possible, say by Thursday. We're just looking at the specific attributes for these vaccines that makes them a bit different from the other vaccines.
However, receiving the vaccine will not be a walk-in. Eligible individuals, for example, example, Kenya's 500,000 teachers will have to be pre-registered. Individuals will need to receive at least 2 doses of the vaccine. During the rollout, the Ministry of Health will hold a second dose reserve to ensure that the individual receives the same vaccine. The deployment plan will identify national priority groups and with support from the different counties will identify and develop their pre-registration records of the different groups prior to vaccination.
For people who qualify to be vaccinated, the choice is yours, but choose wisely.
Dorcas Wangira, Citizen TV, Nairobi.